Thank you for joining our webinar today on getting ready to onboard new third-party healthcare resources in days. Please note that this webinar is being recorded. During today's webinar, our first speaker, Stephanie Hagopian, VP of Sales Technology Integration at Focal Point, will provide an overview of the Focal Point and SecData's partnership and how valuable this solution is to the enterprise when considering third-party identity risk. Then Jen Kraxner, Senior Solutions Advisor at SecData, will provide an overview of the SecData third-party identity risk solution. Next, we will dive into the issue of quickly onboarding physicians, nurses, and other workers and how Focal Point and SecData can help. Finally, we will show a demo of the program and then answer some pre-submitted questions. So with that, I will turn the webinar over to Stephanie.
Great, thank you. Thanks, Nikki. So Focal Point is a consulting firm entirely focused on helping organizations identify and classify, mitigate, and effectively monitor and manage their data risk management challenges. All of our service offerings align to that paradigm, and that paradigm is heavily focused on attaining a zero trust model, which has a lot of relevance for healthcare institutions because healthcare providers have to be hyper diligent about protecting patient data and personal health information while still ensuring that they deliver an immediately responsive and agile quality of care to their patients. And ultimately, it's all about patient care and patient safety that dominates what our healthcare customers really care about. Focal Point in particular, we've been focused in the healthcare space for over a decade. We've worked with a lot of healthcare providers on initiatives related to assessing and attaining HIPAA, high-tech and high-trust compliance, applying the proper mitigating controls, and ultimately implementing technology and process improvements that track what both workforce and external users access within those core institutions, as well as with affiliated entities such as universities and referring clinics. And that's really the focus of what we want to talk to you guys about today, is how do you manage not just your internal workforce users, your clinician community, and your full-time employees, but those affiliated entities, which tend to be the most difficult to manage. We are, as a combined entity, Focal Point and SecData, hyper aware of the complexities that naturally pervade our healthcare providers from a security perspective. We understand that user types are varied and mutable. Credentialed staff often serve multiple clinics or hospital units, and they function almost always in more than one specialty or role. We also understand that clinicians really need timely and appropriate access to critical medical equipment and information to ensure the proper levels of patient care and the proper levels of patient safety are met. And this requirement seems straightforward, but it's challenging for a lot of our healthcare clients to ensure that right level of access is being granted, especially when that community of users is ever changing depending on their location, the time of year that they're coming on board and working with the hospital and the patient community, and the particular medical needs and demand of the patient community themselves, which we'll touch on a little later in this webinar. And our partnership with SecData honestly stems pretty organically from our focus as a firm on identity-related challenges, and these identity-related challenges in particular. We've always contended with the need for our healthcare clients to quickly and appropriately onboard, manage, and offboard, like I said before, every type of user that's affiliated with the hospital, but in particular with users who are not centrally managed by any HR system, such as non-employees and affiliate users, like those referring physicians, volunteers, residents, researchers. Those non-employee users must be handled in a way that is risk conscious or risk aware as any non-employees who have access to clinical systems and most likely PII or PHI data should arguably be managed with more scrutiny than anyone who is part of the internal workforce. As an organization, you just have less overall visibility into who those users truly are and ultimately what risk they pose to your institution. So our partnership with SecData, combined with our complementary partnerships in the identity governance or the identity management and the privileged access management space, allows us to provide healthcare clients with holistic, integrated methods for securely managing non-employee access that starts from the beginning, and that's really where our focus is today, is starting from the beginning, when that user needs to be onboarded into your institution and carries through their life cycle of varying system, device, and building access needs during their entire affiliation with your institution, right up into the time and when their access is no longer needed. So what we've been seeing recently since, and everyone's got to mention COVID in every webinar nowadays, but what we've seen, and I swear this will be the only time we talk about COVID, I'm sure everyone who's listening to this is sick of hearing those words, but it is extremely relevant, of course, for our healthcare clients and for healthcare organizations across the country, and really on a global scale across the world, that since this pandemic has hit us a few months ago, there's always been a challenge for healthcare entities when it comes to onboarding and managing these non-employee user types, but it has absolutely hit critical mass recently, because so many healthcare providers have needed to onboard volunteers and affiliated clinicians in a very short span of time due to this imminent need that's really stemmed from the heavy influx of patients with COVID who need to be properly treated. And the urgency to which these users need to be onboarded is admittedly now a problem of the past for folks who had to contend with it back in February, but there's a requirement in the near future to offboard those users once they're no longer needed and that the curve flattens. And to understand that the issue is not going away in the long term. I mean, like I said before, managing non-employees has always been an issue for every healthcare provider we've ever worked with. And even within the context of this pandemic, we already know there's predictions that there will be an uptick again, hopefully not, but that there might be a second wave that experts are predicting will happen this fall or winter. And then once again, providers are going to be faced with the challenge of rapidly employing additional clinicians for a temporary or maybe an unknown span of time. And even if a vaccine is released, there's always going to be a need for providers to have a sense of operational agility as it pertains to their ability to quickly adjust to new patient demands. Like I said before, it's not a new challenge. It's just become a much more visible need in the wake of this global pandemic that everyone's been contending with. And in order to really manage non-employee access in the long term, healthcare and providers should embrace technology that can centrally store all of those users in one place, and also properly assess the risk level of that user or user community as it relates to their exposure levels of PHI and PII data, and how much access to that data they truly can have during their tenure at the institution and at the provider, as well as with all the associated clinics. And that notion of centrally managing non-employee users of all types, so the affiliates, the students, the researchers, even vendors and contractors, it provides enormous benefit for healthcare providers like yourselves, because centralized visibility into that user data ensures actual visibility and accountability into the user population from a compliance and from an audit standpoint. And that's really what SECS data is all about. So with that, I'm going to turn it over to Jen so we can talk a little more specifically about SECS data and how it can help your institution around the challenges that I just talked about.
Thank you, Stephanie. Yeah, so that's a great introduction into how SECS data can help. You know, it's really important to acknowledge and understand that you know, even with the current pandemic and the climate that there is right now, you know, these problems aren't going to go away, and we're always going to need that operational agility in order to properly not only onboard workers, but also keep track of them while they have access, and understand when that access needs to be removed, and really have a good handle on their status with an organization. So those are a couple of benefits that SECS data really introduces. And as Stephanie was mentioning, you know, there are a lot of different folks that fit that are categorized as a non-employee. When you think about people that don't exist in an HR solution but still have access within an organization, that's a very large group of people. And when you think about, you know, how does SECS data fit alongside some of these other systems that might already exist at an organization, you know, we like to give a little bit of an idea of how we do that. So So SexEdit is intended to be that system of record for non-employees, including, the researchers, the medical staff, the contingent workers, contractors, even to the non-human accounts. There are a lot of service accounts and bots and things that need to be managed that as far as access goes, but they don't have a record within an HR solution. So SexEdit provides the means to have an authoritative repository of those identities. And we also provide a means for a multitude of end users to contribute to the lifecycle management of those entities. So anything from, in the healthcare space, you think about affiliate clinics or, even the business line or liaisons, things like that need folks like that need to have a little bit of say into what the status of one of these non-employees or contractors is. So we provide the ability to really get that kind of collaboration among those external third parties and the internal business line. We provide, life cycle and collaboration in order to feed those identities and all of that authoritative data downstream to identity governance solutions, to access management or privileged access management solutions, even to ITSM tools, in order to properly manage the access, perform onboarding and offboarding tasks, all of those things that really take up a lot of an organization's time when it comes to managing these non-employees. So how are we as SexEdit and Focal Point able to, kind of create efficiencies within organizations that are struggling with some of these onboarding and offboarding tasks? We have a few just examples of use cases that we're able to, quickly support within SexEdit in order to kind of alleviate some of the burden of onboarding and offboarding and tracking these guys. This is an example of a workflow that can be kind of quickly put into SexEdit in order to manage the life cycle of a lot of the workers that are coming in on a very consistent basis right now, especially. So we're able to, when it comes to onboarding a new worker, we're able to support both a self-registration process where a worker, a physician, a clinician, a volunteer, anybody that's coming in as a non-employee can self-register, and I'll walk through a demo of that here momentarily. We can also invite those people to come complete a request form, fill out all of their information. This eliminates a lot of the back and forth that is happening when you're trying to gather all of the detail about these new workers in order to get them into your system appropriately. And then once that invitation or self-registration happens, we're able to properly track all of that data. We can support all of the different types of approvals or pre-onboarding tasks that must happen before you actually officially onboard a worker, create a profile, and provision downstream access. And we're able to track and audit all of that information so that we really understand why somebody was given access downstream, how they came on board, what their status is, how long should they have that access, things of that nature. So building these types of workflows into SexEdit provides a lot of efficiencies for all of those folks that are right now burdened with the process of gathering the detail and recording it somewhere and really proactively maintaining that information in order to truly understand the identity of the person that has access to resources. Another example of a use case that is sometimes overlooked because there's such a rush to get people onboarded and get their access provisioned. A lot of times we kind of forget that at some point we need to be able to appropriately remove that access and offboard those workers, which means we really need to proactively maintain a lot of their information. Well, SexEdit is able to do date-driven terminations where, when you bring somebody on board, we're going to immediately consider what does that mean for how long they should have access. So we designate those times as they're coming on board. when those end dates are reached, we're able to actually reach out, make sure, you know, that that access should be removed, see if extensions should be granted. If in fact an extension is granted, we just define a new end date and continue that process so that we're proactively maintaining the information on that person. Once the end date is reached and termination does happen, offboarding tasks can also be coordinated via SecZetta, and that history of all of the status, the offboarding, the onboarding, all of that history is maintained within their profile in SecZetta, so that we're able to support those audits and compliance requirements that really land on a lot of these non-employee workers. So with that, I'd really like to jump in and show you how we do a few of these things, and I'm going to go through a quick demo just for a fictional health system that we have set up here. And just to introduce that demo, I'll tell the story of what we're going to go through. So we have Springfield Health System here, and Springfield Health System has a couple of folks couple of players that we're going to work with. Julian here is an identity and access management administrator at Springfield Health. He has a lot of access within SecZetta, which Springfield Health System has in place to manage all of their non-payroll, non-employee workers. Leah is a clinic liaison for one of their clinics, their affiliate clinics, and that clinic is Simpson Medical Clinic. Simpson Medical Clinic is going through a lot of, obviously a lot of onboarding activity right now, and they're bringing in a lot of new physicians and clinicians in order to support the work that they're doing. David here is an affiliate site manager at Simpson Medical Clinic. David is actually responsible for really maintaining all of the different workers and the information about those workers that are coming in. So Simpson Medical Clinic actually has their very own portal into SecZetta, into Springfield Health System SecZetta, and they're able to onboard, terminate, manage all of the different clinic workers that are onboarded at Simpson Medical Clinic. So for our demo, we're going to go through the process. What does it look like to onboard a new physician into Simpson Medical Clinic? And that physician is going to be Dr. McManus here. He's coming in to help out for just a short time, but we really want to streamline that process of getting Christopher into the system. And we're going to see what that looks like for Dr. McManus to actually self-register. So there's not any burden on Leah as the clinic liaison, on David, even as the site manager, to initially gather all of Dr. McManus's information. We're actually going to let Dr. McManus or potentially, you know, one of his delegates to register for him. So we'll see what that looks like. So we're going to start again in Simpson Medical Clinic's external portal. This is where David, our clinic liaison that we talked about, our clinic manager, could log in and manage all of those workers. This is also where Dr. McManus would go in order to do his initial registration. And keep in mind, David, our delegated administrator there at Simpson Medical Clinic, could also invite Christopher or Dr. McManus to come on board. In this case, we're just going to have Dr. McManus visit this site, click on clinic worker registration, and complete some information. One way that we're able to actually make sure that only the right people are registering is by whitelisting email addresses, you know, enabling some sort of check prior to allowing somebody to kick off that registration process. So in this case, we're going to have Dr. McManus enter his email address and send a verification to ensure that he's able to actually complete this registration process. And what we'll notice is that email went, just to make sure he has access to that email, we've verified with a registration code, which Dr. McManus will put back into the system and submit. After verifying that he has access to that email, he's able to fill out that onboarding request form. He indicates that he is a physician. And in this case, we're just entering a little bit of information in order to understand who's coming on board for us. These forms can collect whatever information is necessary. It varies quite often from not only organization to organization, but also potentially, from type of worker. So if as a physician, perhaps Dr. McManus needs to enter specific information, where if he were a volunteer or a student would enter something a little bit different. We can adjust some of these things based on that. I'm going to just fill out a little bit of information here for demo purposes, but as you can see, we can collect anything that we need to in order to properly onboard Dr. McManus, including attachments. So perhaps he has some licensure or credential proof that we want to see. If there's, a driver's license or passport in order to do proper identity proofing when Dr. McManus comes on site, we can collect any of those attachments in order to pass that along to those that need it. And then finally, we're also able to present agreements to, to these workers as they register. So in this case, we're showing, an acceptable use policy for Dr. McManus to agree to. This quite often, especially, these days, is a remote access agreement, something that they need to potentially, agree to in order to get to provide telemedicine or get access to different EMRs, things like that. You're able to present whatever information is necessary to gather that from these workers. So once Dr. McManus has submitted that form to register, we're able to run a number of different tasks within this workflow in order to properly complete all of the pre-onboarding steps that need to happen before we actually grant Dr. McManus any sort of access to systems. In this case, as a Simpson Medical Clinic worker, having registered there, we've actually automatically assigned Leah as his clinic liaison or as his sponsor within Springfield Health System. And the next step that's being required here is approval from Leah as that liaison to make sure that he's appropriate to onboard. So we're going to jump over to our internal portal into Sexeta and log in as Leah. And what you'll notice is Leah manages a number of different clinic workers. As that Simpson Medical Clinic liaison, she's able to see everybody that she manages the life cycle for. She's also able to invite other clinic workers to register or onboard clinic workers directly. But importantly here, we can see she has a pending action, and this is actually the request that Dr. McManus just submitted. So Leah here is being asked to review all of Dr. McManus's information. Understand, we assigned Simpson Medical Clinic as the affiliate. The other thing that we've done here is we automatically assigned David Pirelli as that delegated administrator. As you recall, he was the office manager out at Simpson Medical Clinic that's able to actually do a little bit more lifecycle management for the clinic workers. We've also automatically assigned an end date, meaning, and this was automatically set for 45 days out. In order for this to be extended, it will have to, Dr. McManus here will have to go through an extension workflow. And then we can do things like assign additional sponsors or designate specific activities that need to happen after or as Dr. McManus is onboarded. So things like, will we be providing company training? Will he require remote access? And will he be required equipment? So some of these are the questions that the sponsor will know. This could also be posed to David as the delegated administrator if necessary. In this case, we're going to have Leah go ahead and approve after completing that information. And what you'll notice is there's actually an additional step that's been configured within this workflow for credential verification. So because Dr. McManus is a physician and we need to verify his credentials and potentially check references or do some of these other tasks that are required to onboard him as a physician, those different tasks can also be built into the workflow in Sexeta. In this case, we have this presented to Leah as a sponsor, but in reality, in a production environment, this would truly go to more of a medical staff or credentialing office to do the checks with whatever is required for that particular organization. Once that credentialing system is checked and verified, they can approve this step. And at this point, Dr. McManus would be onboarded. His profile is created within Sexeta. He also has risk scores being assigned. So this helps us understand, potentially what sorts of revalidation or additional measures maybe we want to take for Dr. McManus based on his risk score. We're able to drive different workflows and things off of that. And as you can see, we've tracked all of the information that we gathered about Dr. McManus. We've also assigned things like date of next review. So in this case, Springfield Health System is requiring a review or identity revalidation every 30 days to make sure that each of these clinic workers that potentially have, significant access to information, we're able to actually revalidate on a very regular basis whether they still require that access. And we can do this by assigning those revalidations to the sponsor, to Leah herself. This revalidation could also go out to the delegated administrator, who is David Pirelli. So all of these things can be configured within the system and can be dependent on the specific non-employee population that we're dealing with, whether that is a physician, whether that is a researcher, whether that's a vendor, contractor. You're able to drive the timing and the types of workflows specific to that non-employee population, which helps improve all of the efficiencies around actually managing the life cycle and the access of these individuals. So that is the demo that I was hoping to go through, and certainly, happy to answer any of those questions at this point.
Thank you, Jen. So we do have a few questions that were submitted earlier. The first question is, how does sex data differ or interact with a user lifecycle management solution such as SailPoint or One Identity?
That's a great question. So as we walk through each of those, as we walk through that onboarding workflow, the final step that we saw in the SexZeta demo was the creation of that profile. And in reality, that creates that authoritative source that would then be, like I said, a source of authority for those downstream IGA solutions. So during an onboarding activity, creating that profile, the follow-up step could be to send that identity to an IGA solution in order to create the digital identity and do all of the access provisioning and the governance around that access following that individual being onboarded. And further, we talked a little bit about that offboarding use case workflow as well. When that termination happens, so if a clinician, when Dr. McManus in this case was offboarded at a future time, SexZeta again has that authoritative status for Dr. McManus, and that status of terminated, or even if it's on leave, or even a conversion or a transfer, that type of status and life cycle action can be sent to a downstream IGA solution via API or other connector in order to appropriately update their digital identity and all of that downstream access, like I said, as appropriate for whatever that life cycle change is.
Yes,
Okay,
this is Stephanie. I can add a little bit there too. So SexZeta, a great way of kind of imagining that line in the sand between a user lifecycle management solution and a solution like SexZeta. SexZeta is handling all those pre-onboarding tasks, and SailPoint really is what happens after a user gets their credentials and what they need to access day one. So Jen really hit on this as well. But we work with both of those solutions. We work with SexZeta, and then we work with user lifecycle management solutions like SailPoint and One Identity Manager. And those solutions are great at managing user access, but to actually store users who especially aren't FTEs, even though those solutions can act like a source of truth for like a user community, technically the actual registration and onboarding process isn't what those solutions have been designed for. So we always, for over a decade, we've had, especially our healthcare clients have asked us, how do we really manage the actual onboarding of those non-employee entities, and there was never an elegant solution for that until SexData. So that was really the use case that kind of drove, SexData coming into being, and they are very much a separate piece of the equation that's really at the forefront when you're handling our pre-onboarding tasks. So I wanted to add. Thanks, Nikki.
Thank you. The next question is, my company is undergoing cost-cutting measures. How can SexData and Focal Point help us cut our costs?
Yeah, so I can take that on. This is Stephanie again. So I'm not surprised to hear that question in light of what's going on in the world. So cost cutting is a fact, and we understand that budgets are being scrutinized. It's really important to understand the value proposition behind investing in a solution like this. So there's kind of three major things to just kind of keep in mind that SexData and Focal Point from the perspective of actually implementing the solution, the way that we can help cut your costs. The first is just understanding that just managing non-employee entities is a costly paradigm when you don't have a solution to manage those user types all in one place. So most healthcare entities we work with, it's not just one community of non-employees. There are dozens of types of non-employees that are all being managed in disparate fashions, and there's different processes tied to each of those communities in terms of how they're being onboarded. So the administrative overhead associated with that, it can be incredibly costly when you really break it down to how those users are being monitored, and there's always some human beings who are going to have to manage each of those individual non-employee communities. So when you add it all up, there's a lot of costs tied to that. So a lot of times when we do value analysis of why you would invest in something like this, it's that administrative overhead that's really kind of the key point when you talk about how you can reduce overall cost. And that's because SexData is managing all those users in one place. It's a consolidation effort, and there's also automation behind that onboarding process that wasn't there before. And any type of automation is really going to reduce a lot of that administrative overhead. The second is just HRIS solutions are expensive in terms of managing users. So most organizations that we talk to, there's a huge difference in managing users in SexData versus managing those non-employee users in an HR system like a PeopleSoft or a Workday, or there's tons of them out there, Oracle Fusion HCM, for example. So storing these employee types in a non-HRIS solution has a lot of cost savings benefit, just from a pure, just the actual license cost of managing those users, alternatively in an HR solution. So that's a huge sticking point. And when you actually add up the number of non-employees and look at the individual license cost in the HR system, that can be a pretty hefty number. It could be a really attractive way to get an investment made, with a solution like SexData. And then finally, we do have ways of launching our clients into these solutions in a very cost-effective manner. This isn't like a huge IAM type of deployment. The upfront license costs are very attractive, and the deployment cost is very attractive. This isn't a project that's going to take you months and months and years and years. We have a quick launch program actually that Focal Point and SexData is offering our clients, especially within the current climate of the pandemic. We understand that healthcare organizations especially are struggling because of all the focus on COVID treatment, and a lot of those elective surgeries are sort of being put on the back burner. And because of that, we are offering our healthcare, all organizations, but our healthcare clients especially, a way to quickly be able to leverage this software, this technology, and be able to deploy it for the use cases that we described today, with a very low upfront cost. You can learn more about that through our website.
Great, thank you. And then the last question was, how long does it typically take to implement a solution like SexData?
Yeah, this is Jen. I can tackle that one. Really, Stephanie just talked quite a bit about the time to value is pretty quick with SexData. From a technology standpoint, really getting SexData up and running only takes it can be done in a matter of days. The real effort and the time comes in defining the business processes, understanding, how sex ed can best support those processes and make them more efficient. And that's really where, Focal Point can come in, really help kind of dissect those processes, understand where some inefficiencies may be, also understand, how can we improve them, not only from an efficiency perspective, but also from a risk perspective. How do we make, how do you help mitigate some of the risk that third parties can present to an organization, and then build those processes and those workflows into sex ed to properly manage the life cycle of these users. So it's not a heavy lift when it comes to actually implementing the technology, or these are things that can really, time to value can be, as little as a few weeks to, a month or two, depending on what those processes look like and how those, how those need to be built into the system.
Okay, great. So that brings us to the conclusion of our webinar for today. So I want to say thank you very much to Stephanie and Jen for your time. And this recorded webinar will be available on our website later this week. So with that, goodbye and have a good day.